Hello, everyone. I'm Lynn Cremando for YogaUOnline, and I'm so delighted to be here with a good friend of YogaU, Dr. Baxter Bell.
Hey.
If you hang around with us long enough, Baxter was a medical doctor. Well, you
Still
still,
am.
right? Still a
Still am.
medical doctor, but had a busy family practice and figured out about 20 years ago that his talents would be really well served cultivating health, vitality, and better lifestyle choices via the tools of yoga. So we get to have the benefit of your training, and we always bring you back when we need to pick your brain, your medical brain and your yoga brain. And so today we're going to talk about something, we've been talking about the pandemic. Everybody's been focused on the pandemic.
I talked about it for you.
About it for us recently, and it's a huge topic. But the thing is that life goes on, and the numbers on cancer and the recurrence and the incidence of cancer, if you look at the statistics, they're pretty alarming.
Yeah, it's true.
What is it? Talk about that, because we know that yoga can be a tool. We're going to talk about that in a second, but can you just talk about the prevalence of cancer in society right now?
Yeah, the reality is that there's over 16 million people right now in the United States living with a cancer diagnosis. And that will grow in the coming years, obviously, because our population is getting larger. And the chance of you developing a cancer at any point in your lifetime is 40%, almost 1 in 2, right? So it's huge. It's a staggeringly large number. Now, having said that, some of the cancers will be very treatable. I think about the kinds of common skin cancers that many people get that can be removed in the office by the dermatologist, sent off to the lab to make sure the whole area is clear of cancer cells. But others are going to be much more serious and much more impactful on the person's life. So it's a topic that's going to, if it hasn't already touched your life, it probably will touch it. And what I mean by that is I may be in that lucky group of 60% of people that doesn't get a cancer diagnosis in this lifetime. But I've already had my father who died from a cancer diagnosis about 10 years ago. I have a really good friend of mine who has been dealing with a chronic remission state of cancer that then suddenly developed a secondary cancer recently. And it kind of, because in our friendship, I was, trying to be a support of some sort during that period of time for that individual. And so it's going to touch our lives, whether we're yoga teachers or yoga practitioners or yoga therapists. It's going to touch our lives, and it's going to touch all of our lives. So I think it's a worthwhile topic to spend a little bit of time with, to get to know a little bit in a good way, right? It's like, how can I learn what I need to know without freaking myself out? And then what can I do in terms of using my yoga tools if I develop a problem or someone I know develops a problem?
So I want to talk to you about that. But before I do that, there's been sort of an anecdotal or a belief that yoga is good for cancer. But we didn't have a lot of empirical information, empirical data that could prove that. And recently there has been some funding and some energy allocated to proving what the yogis kind of knew and what we kind of knew. Can you talk about what you've been finding out in the research about the role of yoga in helping with cancer?
Yeah, I think you bring up a really great point, Lynn. If we look back in time, there were certainly a few studies done probably in the 1970s, 1980s around certain health conditions in yoga. But in the last 20 or 30 years, we've just had an explosion of research, and we've gotten funding by the National Institutes of Health in the United States for complementary and alternative therapies around health issues. And some of that money has been allocated to studies around the use of yoga in the setting of cancer care when people are undergoing cancer treatment, and also in the post-treatment period. So the good news is we didn't have this funding and this focus before. There's a greater interest and desire to look at this. part of that really has come about because so many people have been turning to using yoga tools and Tai Chi and you name it, these alternative therapies. And they were spending their dollars, their non-insurance dollars on these treatments. And literally the medical system had to go, whoa, maybe we better look and see if these things are actually doing something beneficial or if they're actually detrimental to our patients. And so in a sense, this trend was motivated by the fact that people were already using yoga when they were undergoing treatment in the post-treatment period. And probably they were sharing some of that information with their oncologist and their, the people in their team. And people said, wow, we better take this seriously. People are using this stuff. So we got the funding. We started to see a lot more research done. I mean, there are hundreds of research studies, probably at this point, well over 100 research studies that have been done looking at yoga applied to certain aspects of cancer treatment and care over the last 20 or 30 years. They're not all great studies. There's a large variation. Some of them are better designed than others. And so, we do have to look through a critical filter, a discerning filter, so we can bring in the ideas of yoga here. The mind has to be discerning when we look at the research. But the good news is that there is at least a core group of 15, 20 studies, 30 studies that are decently done, that have started to show some results that we can actually hang our hat on when it comes to the benefits of yoga in this setting that we're talking about today.
That's funny as you're talking, because I was thinking yoga is a huge, it's varied. There's a lot when you say yoga.
What do you mean?
It could mean a lot of things. When you say cancer, there's diagnosis, there's treatment, there's post-treatment, there's, people even in remission, I imagine it never leaves you. That sort of, is it coming back? Is it
right? Yeah.
Looking
part
over
of
my
your history,
shoulder,
right?
coming back. Yeah, it becomes part of your story. Do you find that the research is getting more honed in so that, for example, what kind of yoga? How is it applied? Is there a consistency? I think, hasn't that been a real weakness in the early studies, that it was so like, we just went to yoga and they don't feel better.
In some ways, the early studies were almost like anecdotal reports. I had 5 people do this practice and they reported that they slept better. And there was no secondary group that didn't do yoga. There was no description of what they said. I had them do some poses and some breath work. And in the study, there was nothing listed out like, well, what poses did you do? How long was the practice? Was it consistently that length, and how frequently did they do it? So there was a lot of shortcomings just on that basic information sharing side of things. So the good news is, in 2022, it would be very surprising to see a study published now on yoga that wasn't very clear on how frequently the yoga was offered, the exact protocol that was used, what were the components that were utilized, was there any allowance for variability? In other words, did they allow the teacher sharing these practices to the people with cancer? Did they allow for different propping or modifications? How long the practice was done? How much home practice was done, and how was that assessed? Was there a journal that they had to fill out? Was there phone follow-up? So there more and more detail, so that you're very clear on what the protocol, what the delivery of yoga was, right? Mm-hmm. And then being very clear on the tools that were used to evaluate the outcome. So whereas 20 years ago they might not have used the contemporary health outcomes, quality of life measures that are now utilized in almost all studies of this nature. This is a standardized questionnaire that gathers pretty reliable data from people. Now, if you look at the studies, they say right there, the HOQOL is in there, the quality of life. They use that measurement tool. And so now I know, I'm familiar with that. I evaluate research. I can now say, this is good data that they're getting here. Right? So they're getting clearer on what they're delivering. They're getting clearer on how they're evaluating it. They're getting better about having a control group to compare with the study group. That's still a problem in some places. So, and sometimes they're blinding people to the purpose of the study. Now, if you have cancer, you have to figure, I'm in a study, it probably has to do with whether or not this treatment's good for my cancer. But in other settings, they're actually blinding people in the study. You don't know if you're in the control group or the study group, and that way you get even better data, right? So the researchers are getting more and more sophisticated. And so the research becomes more robust. The results of the research can be relied on more accurately and confidently as we try to apply the lessons learned with the real people that we're dealing with in our lives.
Now, so this is the cancer research. I wonder if, is it possible to actually open the lens a little bit and say, we know that, I mean, I imagine that moment when you get that diagnosis, so you're sitting in the doctor's office, and sometimes it's been a process. I mean, I know someone who went back 8 or 9 times before the word cancer was ever said.
Right.
They thought they were doing this, they thought they were doing that, and all of a sudden they're sitting there talking about cancer. And I think of that moment as being just an overwhelming, so many things come crashing in, and I think of it as just a kind of a nervous system dysregulator from the get-go.
Yes.
Even people who don't have it or are living with someone who has it. Can we extrapolate from other studies that have talked about the effect of yoga on nervous system regulation, or practices that are yogic in nature on nervous system regulation? Can we extrapolate from those benefits to people with pre-cancer, cancer, post? Is that a fair?
I think we can. I think if we're clear on what we say we're trying to impact, we can definitely do that, right? So if we know, for instance, there's a huge body of research and practical experience that that yoga practices address chronic stress management, which is intimately tied to the autonomic nervous system functioning and being well balanced, right? And we know that chronic stress dysregulates the autonomic nervous system of many people, as do other things, like long COVID, there's autonomic dysregulation as an example. And we know from research that the yoga tools can rebalance the autonomic nervous system. It can have an impact on the hormonal system, as exemplified by the hypothalamic pituitary axis, adrenal axis. So we know these things from non-cancer yoga research. So if someone is just getting their cancer diagnosis, they had no symptoms, they just had a screening test that, for example, gave them the diagnosis. So they've been feeling normal, healthy. They went in for an annual checkup, and one of the screening tools applied at age 40 was a screening for colon cancer. And they go back in for the follow-up, or they have a phone call or a Zoom meeting with their doctor, and the doctor says, I've got some really serious information to share with you. I hate to be the bearer of bad news, but I've discovered some cancer cells in that screening test that we did, or some evidence that we're gonna have to do this. As you said, in that moment, the existential crisis that arises for that person is going to probably throw them into an acute stress reaction that could develop into a chronic stress reaction. We know from research that if we started to apply some of the tools of yoga, in a delicate and respectful way, that person might be able then to rebalance that system and then work in the best way possible with this change, incredible change that's happening in their lives. This unwanted visitor that is the cancer diagnosis.
How important is your mental and emotional state in solving what may be a physical or an autonomic nerve? No, it's the
dysregulation, the autonomic dysregulation.
Not the autonomic, that's actually the physical, the cancer part, the disease progression. How important and how much sway could a yoga practice have on that process?
Sure. So none of the research that I've looked at has shown that yoga kills cancer cells, that yoga reverses the cancer process. But it is showing more and more evidence of being a part of a process towards healing. right? We don't know exactly what that process is. They have researchers haven't gotten to the point of looking at the effect of cancer cells under the microscope when someone's doing yoga, for instance, right? But we know it's invaluable because if I can actually impact the presence of chronic stress, if I can improve the person's overall well-being, we know that that actually impacts the immune system function, and that the improved immune system function improves the chance of recovery and survival. So there's this support of systems that also support the recovery of that person.
Thank you for answering the question. I was having such a hard time asking.
Yeah, no, I mean, because it's like we want to tease out, like, well, what part of it does it play? Right now, I think I am perfectly satisfied as a former family physician, as a continuing medical professional, as a yoga therapist. I'm completely comfortable with saying to folks, the yoga is a great way to support your healing process. It's going to support improving your sense of overall well-being. We're going to be able to address this persistent stress feeling you're going to be feeling in your body that comes up as anxiety, as it comes up as a worry and fear of uncertainty. It's going to do a really good job of helping you cope with those things more effectively. And all those things are probably going to help you feel better and potentially do better through the course of your treatment. That's enough. And as yoga teachers,
because treatment can be really, really uncomfortable, correct? Really
what's that?
heinous. The treatment can feel as bad as the cancer, can't it?
In fact, especially in the early stages of almost any cancer, it's felt that the treatment can feel worse than the disease, right? At least for the period of time of active treatment. And that becomes the big challenge during treatment, is to acknowledge I'm going to feel poor physically, mentally, emotionally. Stuff is going to go on in my body that it's never seen before. And, so there's that acknowledgement that the treatment can be, in many cases, extremely impactful. And that, ideally you're going to have, you want as much support as you can get around those periods when you want to hopefully support the body so it can come back from the intensity of the treatment.
So those are the places where a full bag of tricks, of yoga tricks, is going to come in handy. Is that right?
Oh yeah, yeah. I mean, we've got I call it the toolbox. We've got our toolbox of stuff we can grab for on any given day, and we're going to have a lot of great options. And we'll get into this in the program. I don't want to give too much away in our discussion today, but these are going to be things that all of us are somewhat familiar with. But the way we apply them might be different depending on what's going on with ourselves if we have a cancer diagnosis, or with our students if we're working with someone who has cancer and they're coming to our public sessions, for instance. And, they'd like to still be part of the community because, being around other people and in community can be important for the healing process also, right? And so, how do you navigate that, and what tools can you use? And if you're a student, can you have enough in your toolbox that you can know what to grab, or can you make a liaison with someone who's a yoga professional that can give you a little bit of guidance periodically? And if you're a teacher, can you be adept enough that you can actually work with your regular students and this person who might need a little special care during class, and some ability for you to provide alternatives and modifications while they're in class. So those are the challenges I think that always come up when you're working with any health issue as a yoga teacher, is do I know enough about this that I can actually be a benefit to this person? Can they be safe in my class? Can they get the secondary benefits of being here that aren't directly related to their cancer in a way that's, that I can do with relative ease?
But the good news is that staying in your yoga teacher or yoga therapist lane, you can still do a tremendous service to a person if no other purpose that you serve is to recognize the person who is living through something.
Absolutely.
Rather than looking at a diagnosis.
Yeah. And yeah, you don't want, in your mind, you don't want to be saying, here comes the breast cancer person. Yeah. It's here comes my student who's on a journey with this cancer diagnosis that they have. You want to really see them as that whole person. And, we'll talk about some paradigms of looking at the individual that sees them as an interconnected whole. Some of the stuff that's being utilized in the world of yoga therapy today and use some of those tools and ways of approaching the individual. And we'll try to cultivate that continued awareness of seeing the individual as a complete human being.
So what you're talking about right now is that you do have a course coming up for us. We haven't done that, so we'll of course
I do.
Working with but all aspects, really, the treatment, the post-treatment, the whole piece, the whole person treatment in working with and being around cancer.
That's right.
So this is a course that you're teaching for us, and we'll be looking at some of this good, the bad, and the really, really ugly on this thing.
That's right. And we're calling this facing the threat of cancer with yoga because I think it's a way of turning towards. In yoga, we often try to embrace the reality that we have. We don't hold it too close and get smothered by it. We don't push it too far away. And I hope that in the course of talking about what we know about cancer and the realities of it, and what we know about yoga and the realities of yoga, that we can find a nice meeting and get support using our yoga tools in that setting.
I think that word that you use, threat, is exactly the right word. I think at that moment you are so,
yeah.
When you feel so threatened, it would be great to know where to go for help in terms of the soothing, the nurturing, the supportive, the non-Western medical intervention side of the coin. So we will be looking forward to that course coming up soon. And thank you so much for talking about, it sounds like we are just on the precipice of lots of new information coming out that will be science-backed and will prove what most of us feel in our hearts, that we always knew, that yoga can be helpful in working with a lot of conditions, but cancer certainly being one of them. So thank you so much.
You're welcome. It's been a delight.
We'll talk to you soon.
All right.
See you in class. Bye, everybody.